Hello everyone, this is Brittany, Maddie, Maria and I'm Laura. We're a group of healthcare professionals and throughout this panel we are going to answer some frequently asked questions that consumers of mood stabilising medications have. Mood stabilising medications are drugs that help treat and prevent the recurrence of bipolar affective disorder, acute episodes of mania and depression, epilepsy, chronic pain, neuralgia and migraines. Occasionally they can be prescribed to assist people with schizoaffective disorder, borderline personality disorder, and even to supplement other medications such as antidepressants. Although each individual diagnosis may vary and individual mood stabilizing medications can work differently, they all ultimately affect the function of the central nervous system. In case you're unsure what the central nervous system is, it's also known as the CNS. It refers to your brain and spinal cord. Your brain and spinal cord are ultimately responsible for your mind and body's function. Together they control the things that we subconsciously do, such as walking and talking, and the things our body does automatically, such as breathing and digesting food. It also influences our senses, emotions, thoughts and memory. The way in which it controls all of these functions is due to the nerves in the spinal cord carrying messages and instructions from the brain to the other parts of the body. In short, mood stabilizers work by increasing and or decreasing your mind and body's ability to respond to messages that your brain and spinal cord transmit. As there are several mood stabilizers that consumers can be prescribed, Maddie will go into more detail about different options, how each one works, and some potential side effects.
The main two mood stabilizing medication categories that people are prescribed are lithium, which is a mineral, and anticonvulsants. Due to the importance of a consumer having accurate and in-depth medication knowledge, I'll focus on lithium and Maria will cover anticonvulsants. Lithium carbonate is a mineral and is the main mood stabilizing medication used to treat acute mania, unipolar depression, aggressive behavior, conduct disorder, and schizoaffective disorder. It is also used for the ongoing maintenance of bipolar disorder. Although lithium has been utilized as an effective mood stabilizing medication for over 50 years, the way in which lithium exactly works has only recently been discovered within the last couple of decades, and some parts are still unknown. It is suggested that lithium mimics the effects that sodium has on your body. This means that it inhibits the ability of neurons to release, activate, or respond to neurotransmitters. It also reduces the sodium content of the brain and increases serotonin synthesis and noradrenaline reuptake. Serotonin is a type of neurotransmitter that has been linked to increasing these effects in the body. With this being said, you can see how an increase of this compound will help improve someone's overall mental state. Noradrenaline increases heart rate, blood pressure, and happiness. Increasing the uptake of this will in turn lift one's mood. Some side effects consumers experience whilst taking lithium comprise of drowsiness, a metallic taste in the mouth, difficulty concentrating, and increased thirst, as well as what is listed here. Another severe side effect is lithium toxicity, which we'll go into more detail about soon.
Thanks for that, Maddie. As mentioned, the other mood stabilising medication generally prescribed are anticonvulsants. These can be prescribed on their own or when lithium is ineffective. Some different types of anticonvulsants are carbamazepine, valproate, topiramate, and lamotrigine. Like lithium, anticonvulsants all increase and all decrease your mind and body's ability to respond to messages that your brain and spinal cord transmit. Valproate, topiramate, and lamotrigine also inhibit the release of glutamate, which plays a role in steadying an overactive mind. Although there are some relatively common side effects such as drowsiness, nausea, and vomiting among the anticonvulsants, each medication's side effects can differ. I'll cover a few of these other side effects, however you can see here each individual convulsant side effects. There are a few things to note. Before commencing carbamazepine, a range of tests should be performed, including blood film examination, electrolytes, liver and kidney function, as well as performing a baseline ECG. Valproate should not be taken with an aspirin and some other antipsychotics. If prescribed, lamotrigine caution is required in the elderly, pregnant and people with cardiac or renal disease.
Due to these significant side effects, a nurse plays an important role in educating consumers on the use of these medications. As nurses, it's our job to educate each individual consumer on why they're being prescribed a mood stabiliser, how it works and how and when to take it. We must ensure you do not have any contraindicating health concerns and are aware of any potential side effects and what you should do if they occur. If you're prescribed lithium toxicity is something you'll have to be wary of. Lithium toxicity is when a person has too much lithium in their blood. Some side effects of this include stomach pains, diarrhea and vomiting, as well as fatigue and muscle weakness. With severe lithium toxicity, you may encounter seizures, slurred speech and a rapid heartbeat, and in extreme circumstances it can be fatal. You must be aware of these side effects and monitor your blood levels regularly to check the amount of lithium in the blood. We must stress this importance, particularly during the early phases of treatment. Should your levels be too high or you experience any symptoms, you must seek a doctor's advice. If a consumer has been prescribed either lithium or an anticonvulsant, we must stress the importance of taking them regularly, even if they are asymptomatic, as sudden cessation of either can be harmful or increase the likelihood of relapse. We should inform consumers that if they experience any gastrointestinal upset, which is common, they should try administering the medication with meals. They should also avoid drinking alcohol or taking non-prescription medications without consulting a doctor first. If there are any other abnormal side effects, they'll need to seek a doctor's advice immediately. Maria, I've discussed medication-specific adherence. Are you able to go over reasons why some consumers may not adhere to the medication regime?
Certainly. Thanks, Maddie. There are several causes why a consumer may be non-adherent. This could be due to their lack of knowledge and access to resources, a refusal to accept their diagnosis, a fear of side effects, as well as a fear of becoming addicted to their medication. Many healthcare professionals don't build the necessary therapeutic relationship with their client, and clients may not feel engaged with their treatment plan. When consumers don't feel engaged, they are less likely to follow through with their treatment. Socio-economic status can also impact their adherence. If they're from a low-income household, they may find it challenging in affording the medication. Also, living in a rural or remote area that isn't in close proximity to a pharmacy may lessen the likelihood of medication adherence. Other reasons may be the stigma around mental health problems and dissatisfaction with their healthcare providers. With all this being said, try not to let all these elements deter you. As nurses, we can advocate for you and assist you in overcoming many of these barriers, which Brittany will now discuss further.
Although Maria discussed reasons why people may not adhere to their medications, it can be vital that consumers try. There are a number of different approaches that can be implemented to help you adhere and prevent relapses. Recovery is a unique and personal experience. It is a way of one forming and improving to reach a satisfying and fulfilling lifestyle without being impacted by the limitation of mental illness. Mood stabilisers can support a person's ability to recover and restore their maximum potential. These mood stabilisers will assist you in your recovery by reducing episodes of mania, depression, and assist with controlling mood swings, therefore increasing your quality of life. We talked previously about the effects nurses have on educating you about your diagnosis and the medications you've been prescribed. We've covered information such as side effects and how it will affect you. This will contribute to adherence and help prevent relapses, as you hopefully have developed knowledge and education about how important it is to stick to your medication routine. Another great way that you can ensure you're taking your medication accordingly is by using a pill box or a blister pack. This is something you can organise at your local pharmacy and makes it very easy to remember to take all of your medications. We also discussed previously you may come across a few side effects that may lead to negative experience. If you feel like it is too much to handle, then you can talk to your doctor about your side effects, and they may be able to adjust your dose of your medication or provide you with something to help reduce the side effects. By us providing you with all this information and suggesting you will be able to hopefully stay on track with your treatment plan, and by doing so you'll have a more positive experience with your recovery as well as preventing a relapse. Here are a few support services, and if you ever need advice about your diagnosis or medication, you can reach out to these groups for free support. We hope we've been able to answer majority of the questions you may have had and now have a better understanding of mood stabilizers and how it will help your diagnosis. Thanks for listening.